Good day, everyone. I'm Jerry Eddings with the International Center for Journalists, and I would like to welcome you all to this first webinar of our Global Nutrition and Food Security Reporting Program. As many of you know, ICFJ has been in operation for nearly 4 decades. In that time, we have served more than 170,000 journalists from 180 countries with programs that empower you to do the best possible job of informing the public. Our programs are wide-ranging, from investigative journalism to data-driven reporting, to using innovative tools and techniques, to reporting on special issues like business, the environment, and health. For the past 14 years, we have had a major focus on improving health reporting across the globe. This past year, our focus has been squarely on the biggest health issue of our time, the COVID-19 pandemic. In April of last year, we launched our Global Health Crisis Reporting Forum, which offers webinars and resources linking journalists to some of the world's leading experts on issues related to the pandemic. The forum reaches a network of 13,000 journalists in 5 languages. Today's webinar is part of that forum, and we're delighted to have as our featured speaker, Dr. Francesco Branca of the World Health Organization. We could not start our program with anybody better. I'd like to thank our partners at the Eleanor Cook Foundation. We would not be able to bring you this important program without them. You'll be hearing soon from their chief executive. But first, let me just quickly mention 3 people on the ICFJ team who have been critical to organizing this webinar. My colleague, Taylor Divert, you've heard from him many times already in the lead up to this program. Our colleague Paul Adiboju, who's joining us from Lagos, Nigeria. I think some of you may have seen him moderating some of our other webinars on the forum. He's working today to make sure that everything runs smoothly. And our moderator and trainer for today, Mercedes Sayaguez. She is a distinguished journalist with a special focus on health and gender issues. ICFJ has really been fortunate to have her work with us as a trainer and mentor on many programs for many years. Mercedes will tell you about today's program, and then we will hear from Mr. Will Moore, who is the Chief Executive Officer of the Eleanor Cook Foundation. Mercedes.
So hello, everybody. I'm Mercedes Sayaguez. I am the host for the conversation with Dr. Francesco Branca. So let me quickly explain how the webinar will unfold. And also, you have received yesterday on the email short bios of all the speakers, including myself. I have been working with ICFJ as a fellow, a trainer, and a mentor since 2010. So the way the webinar will proceed is Dr. Branca will do a presentation in 2 segments of roughly 10 minutes each. And after each segment, we will have a Q&A. Some will be a selection of questions you sent before the webinar. Another will be fresh questions. So please post those on the chat and we'll select some. And with this, over again, back to you.
Hi, everybody. My name is Will Moore, and I'm the CEO of the Eleanor Cook Foundation. We are a growing philanthropy focused exclusively on the fight to end global malnutrition. On behalf of everybody on our team at the foundation, I'm really thrilled to be here to kickstart this important partnership with ICFJ, and of course, to introduce our guest speaker today. To all the journalists on the call, I also just want to say a heartfelt thanks for taking an interest in a massive issue that's almost always absent from our headlines. Most people don't know this, but in today's world, malnutrition is still the leading cause of child deaths worldwide. Malnutrition isn't just a matter of kids feeling hungry. For millions of families each and every year, malnutrition means the slow and painful death of a child, a loss of a child. We've talked a lot about the 3 million people who died tragically from COVID last year. We haven't talked much at all about the 3 million children who died last year from malnutrition. The good news is we have proven cost-effective tools to prevent malnutrition, and we've got proven cost-effective methods to treat it too, so sick children don't die. Malnutrition is a food issue, but it's also a health issue. And that's why the World Health Organization plays an indispensable role in coordinating and supporting the global malnutrition response. So I'm very pleased to introduce our first speaker in this series, one of the people at the very center of that response, Dr. Francesco Branca. Dr. Branca is the director of the Department of Nutrition for Health and Development at the World Health Organization in Geneva. The WHO has a lot going on right now, as we all know, so we're very grateful that Dr. Branca has been able to make time to join us. He's been a leading expert in this global field of malnutrition for decades. We've worked closely with him at the foundation for a number of years now. In fact, Francesco, this is our second call in a row together today. And I can say to this audience that you are about to hear from one of the most thoughtful and knowledgeable experts on malnutrition alive today. We're going to be getting Malnutrition 101 from a real master. So please also, you take good notes, but feed him some tough questions. With no further ado, Dr. Branca, over to you.
Well, thank you very much. It's too kind of you. I think there are a lot of better people around, but thank you for the acknowledgement. So yeah, maybe what I will do is share a few thoughts with you. Worked before, it should work again. Let me see. So basically, I was starting to tell you about the multiple forms of malnutrition. That is what the SDGs say. You have multiple forms of malnutrition. We have the undernutrition element with particularly children who are under 5, who are either wasted, so they have a low weight for their height, or they are too small, they don't grow. And these are having a low height for age. So you see, we have, these are the latest estimate that WHO publishes together with UNICEF and the World Bank. You see there's about 45 million children with wasting and 149 million with stunting. But there's another form of malnutrition. Already before at the age of 5, 39 million children are overweight or obese. Overweight and obesity is then increasing, unfortunately, it's tracking into adolescence and adulthood. We have targets for these different conditions, different forms of malnutrition. And let me tell you that this is the trend in the last 20 years. While we have done some progress for stunting, so the yellow line, due to improvement in living conditions, healthcare, reduction of poverty, improvement of water and sanitation, overweight and obesity have been growing steadily. And also you can see the number and the prevalence of children with wasting that has still been staying very, very high. We don't draw the trends of wasting because that has a very, it basically is a nearly variation due to particularly the situation of extreme poverty or the extreme, the crisis, the emergencies. But we can say that for the stunting, we have an expectation that by the year 2025, we should go down to about 100 million. You can see we're still very far. Now, this is the current situation, but during COVID-19, a number of things happened. Malnutrition is affected by mainly 3 things. It's affected by food, it's affected by healthcare, and it's affected by social protection and care of children. So if these 3 things are missing, you end up having some forms of malnutrition. So during the pandemic, the food part was affected. We had disruption along the food supply chain. The food was left uncollected the crops were left uncollected in the field. We had problems of transporting food. We had increase in prices. So we had some perishable food which couldn't be delivered. But also we had a big impact on incomes. And so people didn't have the possibility to purchase their food. And we also had an interruption of social protection system, for example, school closures leading to missing meals. So what we call the food insecurity, which is based on our assessment of the discrepancy between the availability of food and population needs, is indicated that we are going to have probably additional 90 million people who are going to go into food insecurity. These are estimates. We published this document, the State of Food Security and Nutrition in the World, together with FAO, World Food Program, and UNICEF every year. Next one will be in July 2021. But we still do not have hard data about what happened last year. I mean, we didn't have the possibility to run surveys, as you can imagine. The other thing that happened is that health services were disrupted. And this is the analysis that we did in August 2020. So, you know, in the middle of, or let's say at the beginning, we can say now, of the pandemic. And if you see what happened, for example, to the services specifically dealing with the management of malnutrition, about half the countries had some form of disruption. And, you know, in some cases, this disruption was absolutely total. We have repeated this service last April, and we still found that a third of the countries have problems in ensuring these services to the population, together with other important healthcare services. You know, look at and a lot of the prevention services were affected. So clearly this is going to have an impact on malnutrition. So again, here we have an estimate. So we're saying that a combination of the decrease in the gross national income that will lead to food insecurity and health service disruption is going to affect malnutrition. So we expect that about 14% additional children under 5, which is about 7 million, will get into malnutrition. This is on top of what we had last year, which was 47 million. We also have documentation about the impact of the pandemic on obesity in children. These are data that are coming particularly from Europe, where it has been possible to have some reports of food consumption. And in this study, where quite a large number of children, 17 million children, were studied. These are all self-reports, of course. You know, there were changes in dietary behaviors, increased food intakes, unhealthy food choices, sugary drinks during the pandemic, and then restriction of movement in the house. So basically, there is a report of increased body weight during the pandemic. Now, what are we doing in terms of achieving the global targets? Are we on track or not? We have a lot of differences between different parts of the world. So you see in the green is basically the proportion of countries in each of the regions of the world that are achieving. The yellow, the ones that are not quite there, but they show some progress. The orange one, no progress. And the red one is where you see actually worsening. And you see that for stunting, there are parts of the world large part of the world where you see progress, but still, particularly if you're looking at Asia or we're looking at sub-Saharan Africa, there are even parts of the world where you have a worsening. Wasting, again, Asia and Africa, that's where we have the largest number of wasted children. Part of it is sort of baseline there, poverty. And part of it is because of additional crises, could be climate-related crises, it could be man-made emergencies. I mean, we still have the hotspots of the emergencies in Yemen, South Sudan, Central African Republic, some of the other Sahelian countries. And then overweight is remarkable because we basically hardly see any progress. So we basically see situations that are either not improving or definitely worsening. And I'd like to point your attention, overweight is particularly worsening in Asia and Africa. So reason of big concern. So I think that really is well, maybe I'll just give you a couple of other slides before we go into the second part. And that is, about the solutions. What can we do about it? We can do something to the health system and basically provide what we call the essential nutrition actions, which are, a set of documented cost-effective interventions that are delivered to all population or to some specific groups, that, for example, are affected by emergencies throughout the life courses. And you see the list in the bottom here. I mean, you start from infants, and breastfeeding and complementary feeding is the key intervention. Then children, where you need to provide a good growth assessment, counseling, and referral. You need, of course, to treat conditions of undernutrition, particularly wasting or vitamin and mineral deficiencies. During the adolescence, it's a critical time, particularly for the need to provide iron, folic acid through supplementation and start preventing what happens later in life, which is anemia in women. Again, for adults, the importance of having adequate vitamin and mineral status. And also, we're now increasingly concerned about the malnutrition of older people. There are things we have to do in the food systems. And the food system, this is actually a very interesting year because we're going to have a UN Food System Summit where there's going to be a large commitment and a large convergence around changing the food systems. We have seen how food systems, which is looking at the whole spectrum from the supply chains and production of food, manufacturing of food, distribution of food, to the food environment, which is what food we can access around us, to consumer choices. So that's the whole food system. And food system is not delivering on a healthy diet. There's 3 billion people in the world who cannot afford a healthy diet. There's 11 million people every year who die as a result of unhealthy diet. So there are several reasons for the change. Food system is also producing a negative impact on the environment. So we need to change that. And we need to change that by having a set of policies that improve the availability, the accessibility, the affordability, and the desirability of healthy diets. So food system change is going to be a very important one. And finally, specifically for the response to COVID, this is basically a call for action that our director generals from UNICEF, FAO, UNICEF, and WHO made last year of 5 urgent actions to protect children's right to nutrition during the pandemic. Safeguard and promote access to nutrition, safe and affordable diet, invest in improving maternal and child nutrition, reactivate and scale up services for early detection and treatment of child wasting, and maintain the provision of nutritious food to schools, and expand social protection system to safeguard access to nutrition diet. So you see, there are some basic transformation we need to make. We need to scale up nutrition services in primary care, but there are also additional measures that are required during this crisis. So I'll stop here and talk to you.
Yes. Thank you, Francesco, for a very informative presentation. I would also like to say we have about 60 journalists who are here because they're eager to report on likely the most underreported issue of this decade's biggest news story. So thank you, Francesco, for pointing us into the direction of many story ideas. And I will use my prerogative as a host to ask you first a question before we go on to the participants' questions. What do you think are the issues about global child malnutrition that are most underreported? What stories are we missing?
I think we're missing the real stories about why people living in poverty are actually affected by malnutrition. And when I say real life stories, I mean stories that are able to explain what are the determinants of this situation, because people, tend to generalize and say, okay, well, it's poverty. Okay, but what are the dynamics of poverty? I think journalism can help a lot having some form of also visual sociology, learn the story. So why does a child in a poor neighborhood in a city develop obesity? Can we describe the environment that child lives in? Can we have information about why the educational system is not able to help in that particular situation? So we need those real life stories which are able to describe us the determinants. That is certainly true for obesity, but I would say that for wasting and stunting, people believe that wasting, for example, is only something that happens in crisis situation, and you hear about Yemen and South Sudan. But the largest number of wasted children actually lives in the outskirts of big Indian cities. We need to learn those stories. So we need to learn the real circumstances beyond those numbers. You're muted, Mercedes.
What are the systems, the food systems that actually create or let's say do not reduce hunger? We'll come into that in another webinar and also in the second part of your presentation. Let me give you a question from Marta Silvia Vigano. She said, can you identify the major trends in malnutrition and how they differ between the global north and the global south?
Okay, there are some important differences because we have stunting and wasting that are somehow concentrated in the global south. As I was saying, particularly South Asia, Sub-Saharan Africa, those are the areas of the world where you have the majority of 80 or 90% of children with those conditions. And in those areas, you don't see necessarily a big change, but there are differences between states. You have some states in South Asia where public policies have been helping acceleration of stunting reduction. In Africa, for example, you have a very good story in Ethiopia. Ethiopia is a success story of stunting reduction. So even within the global south, you have the good stories and the bad stories. The good stories are where there's been public investment in services, where malnutrition has been taken up at the highest level, and it has been considered a development challenge. Then I think for the obesity, I said, this is happening everywhere, but particularly there are some parts of the global south where this acceleration is incredibly quick, absolutely as a result of the responsibility of the food system, making available, the cheap food high in fat, sugar, and salt, making them a status symbol. You have incredible quickly increase in childhood obesity in North Africa, for example, or on the Eastern Mediterranean regions. So indeed, there are circumstances that the food system has determined that we can control.
And in the global north, very briefly?
In the global north, we have seen some good signs, but again, there is a social gradient. So basically, probably the only part of the world where we can see some, at least slowing down of the obesity epidemic has been in the Nordic countries in the high income groups, because that's where a combination of public policies, but also people's capacity to take advantage of policies. For example, the access to healthy diet. There is a cost gradient, so not everybody was able to afford the healthy diet. So that's I would say that the Nordic countries often have a better situation. In other parts of the world, in high-income countries, you still have an enormous social gradient, and United States, some part of Europe, still overweight and obesity is growing very quickly in low-income groups.
Thank you. I have a question from Charles Njeru. What is the impact of COVID-19 on lactating mothers globally, and is there data about it? And I would like to add that the Save the Children report, Critical Nutrition 2020, points out at the inappropriate marketing of baby formula and breast milk substitute by several companies like Danone in India and Paraguay, breaking the marketing code and recommending that women don't breastfeed and instead use their products. UNICEF has also pointed out to contradictory advice from governments. 20 countries had advised mothers with COVID-19 not to breastfeed. Can you comment quickly on that issue? And again, as Charles said, is there data about it? And what is the impact of COVID-19 on nursing mothers?
Thank you. Breastfeeding is one of the 6 global nutrition targets. We would like to achieve by the year 2025 at least half of the children exclusively breastfed for the first 6 months of life. At the moment, we are at 40%. And we have seen some increases. Some countries are doing extremely well in breastfeeding. But during this COVID epidemic, this has been challenged. We don't know what the situation is. I mean, as I was saying, we've not run any surveys in 2020. So we'll have to see what is the impact of this. But yes, I can say that breastfeeding was challenged. WHO and UNICEF had to reassure everybody and issue some guidance explaining that it's absolutely safe to breastfeed children. In fact, breastfeeding shouldn't be discontinued. There were some concerns about, should a mother infected by COVID be separated from a child to protect her or his health. We said no, the breastfeeding should be continued. But as you rightly say, this has been somehow exploited by infant formula manufacturers in some cases to promote the use of infant formula. We've tried to stop that. But yeah, I'm not sure whether we have been able to do that. So there's a concern, maybe not yet materialized. But what we need to do is to have more and stronger legislation against the marketing of food to children, so that this doesn't happen again.
Another question, can you detail the impact of pandemic-related lockdowns and stops in trade and commerce on the supply of vitamin A, whose lack increases the risk of child blindness and night blindness in pregnant women? And this ties with another question about the effects on pregnant women of the pandemic. So vitamin A and pregnant women.
Right. I mean, in general, the position of WHO is that vitamin and mineral supplementation should be provided where we have documented evidence of a shortage. WHO has recently updated the guidance around supplementation of vitamin A postpartum. That is not always recommended. I mean, it's recommended in the context of research. So we don't necessarily always need to provide that supplementation of vitamin A. We have confirmed.
Perhaps, sorry, Francesco, I think perhaps the question is how the problem, the breaks in the logistical supply in trade, commerce, trucking, lockdowns affected the provision of micronutrients, fortified foods and others. We make it broader. What was the effect on that? Not only vitamin A, but all the other micronutrients and fortified foods that are needed. I
mean, as I was saying, what we know is that the provision of services has been disrupted, and particularly preventive services were interrupted, and outreach services were interrupted. So the campaigns, we couldn't do the campaigns in 2020. In some cases, we have evidence of disruption of supplies, but often the problem of the service continuity of services was the fact that people wouldn't go to the health services for the concern of being infected. Health workers were actually moved to other tasks. They couldn't do the preventive services. They had to work on the treatment of COVID. So that is the kind of disruption we have. In terms of the actual supply, yeah, some countries have reported a disruption of the supply, but that's not the main reason for the interruption of the services. You're muted.
Myself. So let's go now into part 2 of your presentation, which deals with food systems, food safety, and One Health. I am following your questions on the chat. We'll come back to you.
Yeah, so the second part of my presentation will be very simple, because I just would like to give you this concept. Okay. Can you see it or not yet?
The pathways.
Okay.
If it's too small, participants can click on the zoom and make it bigger.
Okay. So basically here I'd like to give this concept. Food systems have an impact on health via multiple pathways. And this document has actually been published on our website today, so it's very fresh. We have discussed the first pathway. So we've discussed how unhealthy diets and food insecurity affect health and well-being. But I have to say there are more. One of them, pathway number 2, is the effect that infectious disease that come from animals are transmitted to humans. In the last 20 years, 75% of the emerging infectious diseases have come from animals. And examples are Ebola or MERS, SARS, even COVID-19 most likely has their origin. And the other element of this pathway is that the way we treat the animals, for example, through intensive animal production, requires the use of antimicrobials. But 70% of our antibiotic production goes into animal production. They're used as growth promoters in some cases, but they're used also to prevent animal disease, given the way that these animals are reared, in concentrated places. But having so much antibiotics in the environment will lead to resistant bacteria strain, and that resistance is not necessarily circumvented by new antibiotics. So that's a big deal. The third pathway is that of unsafe and adulterated food. Majority of foodborne disease burden comes from Salmonella and Campylobacter. The majority really comes from diarrheas. But there are other forms of contamination of the environment. We have pesticide residues in the environment. We have the product of waste disposal, such as the dioxins, for example. We have heavy metals such as mercury and cadmium that come from industrial production. Of course, we're trying to keep our food safe, but sometimes, and we have often good control system, but sometimes this escapes controls, and then it affects negatively health. The fourth pathway is that of environmental contamination and degradation. Food system uses up a lot of the resources from the environment, and it also has, kind of waste that can affect negatively the environment, and then through the environment it will affect our own health. And then finally, the occupational hazards. People who work in the food production get sick, and people, farmers themselves, or fishermen, or people in factories. You've seen how, for example, COVID was affecting people in meat factories, but also people who have been distributing food. So it's actually something that we need to consider. The way that we produce and distribute food has also an impact on the workers themselves. So there are multiple pathways, and perhaps considering particularly the second pathway of zoonotic pathogens, I'd like to show you this other slide that shows how the way we're dealing with our own environment is not only creating an impact on the environment per se. So it's not because we simply like to live in a beautiful environment, but that damage we produce is eventually going to affect us. Pollutions, human migration, unplanned urbanization, deforestation, intensive agriculture, intensive animal production will increase the unlikely interaction at the human-animal environmental interface. If you destroy a rainforest, where would the animal go? They would encroach on human habitats. If we extract with the mining industry products from certain environment, where we're destroying ecosystem and displacing the animals. So this is what has happened, and this, in response to this, we are taking what we call the One Health approach. So we're considering that we have to consider simultaneously the health of the environment, of the animals, and the humans, and avoid and take measures to avoid that the damage we produce to the environment will then have such impact down the chain. So this is an important set of implications, because we need to dramatically change way to do things, whether it's animal production or whether it's building of infrastructure or extraction industry. I mean, this is, of course, has very important economic implications, that requires important political discussions, but we're understanding that. And the COVID-19 pandemic has taught us that we cannot avoid taking serious measures there. There's more than 1 million viruses still there, and this will happen again. If we don't change practices, will happen again.
This leads me into one question we got from a participant. Do governments need to have a pandemic protocol to ensure food systems don't collapse if there is a new crisis due to a global pathogen?
I mean, definitely, the COVID-19 pandemic has taught us that food systems are vulnerable. I mean, they're necessary for our well-being, but they are not managed effectively. They don't deliver healthy food to other people. This is 3 billion people who cannot afford healthy food. They're having an impact on the environment. So we need to change that. Then, when the crisis comes, there's no system to compensate. We've seen how somehow there were some immediate responses. I mean, we have seen how during the pandemic, shorter food chains have been rediscovered. Why didn't we think of it before? Social protection systems which are based on neighborhoods, and you have your neighbors getting buying the food for the elderly people. I mean, there have been some interesting responses there, but showing the fact that the system wasn't prepared. And then, we need to know when when there is a risk that a new pandemic comes, and we need to change the food production systems to avoid that those new pandemic come. So yes, indeed, with those pandemic plans, we'll have to consider all these other elements. At the moment, perhaps they are concentrating on the health systems. They should go beyond the health system. One Health is about multi-sectoral action in agriculture, in environment. So those pandemic plans, the new generation of pandemic plans, will have to consider all of that.
We have a very pertinent question from Robert Cheney about very concrete. What would work better? We're going live to Robert. Paul, is Robert ready? I just saw his camera on. Robert?
Robert, you can ask the question now.
Hello, and thank you all for gathering this. When you're looking at trying to get quick and effective results in a community, You have a choice of your local medical institutions that can provide nutrition information and supplies, or your education institutions, your schools that might be able to reach children and families. Do you see a benefit to aiming at one or the other for faster, better results in a place that is suffering severe nutrition? Or is there maybe some other institutional access point that you would recommend focusing attention on?
Well, thanks, Robert. We have multiple examples, but I don't think there's one size fits all. But in general, the response is that we cannot rely on a single set of actors. It has to be a combination. So you need to have health services which are delivering the nutrition services. It's absolutely necessary. You need to have an educational system that, for example, is providing good food. I mean, there's now really a large movement about public food procurements, not just the schools actually, but all the public institutions that could provide healthy food. That would be an enormous driver for change. But also the social support systems. I mean, in the United States, as you know, a very large proportion of the population relies on social support systems. And if that food provided through the social support systems, as it's been, recently, decided by the US social support system, is actually healthy food, that's a big driver for change. So you definitely always have to have a collaboration among different actors, different sectors, under the whole leadership of public sector. We say that food and nutrition action plan are critical. Countries have that. We have this food and nutrition action plan more and more updated with our knowledge of what works and the cost-effective actions to change the food environment. But that's still not at scale. I mean, our analysis of policy responses is that there's a lot of emphasis on education and consumer information, giving the burden of the choice to the people. But what can people do if they cannot access the food, if they cannot afford the food? So we're hoping to get more and more public action on shaping the food environment.
If I could follow up, in the United States—
Very quickly, because we're running out of time.
Yes. In the United States, we are allocating billions of dollars in COVID relief funds, and they are aimed at doing systemic change. What should, especially for us journalists, what should we be looking at in a community with malnutrition? Looking at the schools, looking at the medical systems, what measuring sticks should we ask for that might indicate the best solution for that area?
So, I mean, as you say, this is a great opportunity because, with the recovery funds, with the investment in recovery, we can reshape the system. And public investment is going to drive that change. In WHO, we're saying that there are some cost-effective policies that should be put in place. We say, we need to first of perhaps and foremost is the food in public institutions. I think that's really critical. And you will have consensus from all actors, but making it also, shortening the chain and having a good contact with the local producers. The second one is about restricting the negative information, the marketing of foods, particularly to children. I mean, we shouldn't see that much pushing for the wrong foods and beverages. Third is empowering people to make the right choices with adequate, easy to understand labeling of processed food. Fourth is the pricing, making certain foods more expensive, the one we are discouraging, and providing subsidies towards the healthier food. The healthier food are still too expensive for many people. And working with the food manufacturers to ask them to change the design of their products to make that healthier. So these are the 5 things we're saying that could be done now in this year of the Food System Summit.
Thank you. I wanted to call on Franz van Thon from West Africa, but we're running out of time and we cannot get him to get his camera on. So you have great questions coming on the chat, but time is very short. So I would like to, Francesco, would you be willing to answer some questions by email if we forward them to you? Thank you.
Of course, with
So,
pleasure.
thank you. Taylor, over to you for some final words and we'll come back.
Great, thanks. Special thanks to Dr. Branca for a really enlightening presentation. Mercedes, thanks to you for guiding our conversation. Thanks to Paul, the English language manager for our Global Health Crisis Reporting Forum. Paul managed all the technical aspects for today's webinar. The next webinar will be on June 16th at 9 a.m. Eastern Time. We'll have Agnes Kalibata looking at malnutrition and public policy. So please be on the lookout for an email from me before then. Thanks everyone for attending.